Good morning, doctor. Could you please introduce yourself?
Yes, I am Daniel Simon, and I work with a facial team, a center that is dedicated mainly for facial feminization surgery and facial gender confirmation surgery, and I'm oral maxillofacial surgeon.
How long have you been using piezo surgery for?
I have been using piezo surgery more or less since 2010. We have been changing our work from common reciprocating saws or oscillating saws to piezo surgery gradually, and approximately since 2012 we have been almost using completely piezo surgery and not using any more other type of cutting instruments.
What made you change from traditional rotating and oscillating tools to piezo surgery?
So we were trying to do surgeries a little bit further on the angle of the jaw and the body of the jaw. We work a lot of recontouring of the jaw and chin, and at some point we were not able to perform the surgical maneuvers that we needed. So when we started to work with piezo surgery, it gave us the possibility of making the cuts that we need in a very safe way, and it was something we were not getting with the standard saws. So we changed for piezo surgery.
Which procedures are you using for?
We use now piezo surgery for many procedures inside facial gender confirmation surgery, mainly for the lower jaw and the chin, where we make our full cuts from angle to angle. We work also with jaw and chin recontouring using specific surgical guides like this. So we are developing interesting guides, but the guides, they require very exact cut methods, so the piezo surgery is very helpful. We're also using piezo surgery for sliding genioplasty. We use piezo surgery as well on the forehead recontouring, for osteotomies on the forehead, releasing of the frontal branch of the nerve. We use also for the forehead, and we use it for the osteotomy of the frontal bossing. We use for obtaining grafts from the parietal area. We use it also for release of the frontal branch of the nerve, of the supraorbital branch.
Are there today surgeries you would not do without piezo surgery?
There are surgeries that I wouldn't do anymore without piezo. And mainly I would say procedures done on the skull that are close to the dura mater, and in the lower jaw, any recontouring we will do it to piezo, because we see how different is the effect on the post-op, and how different is the predictability of the cuts when we are using piezo surgery.
Thinking about your patient, which are the main intraoperative and postoperative advantages?
The main advantages in this type of the main advantages in using piezo surgery for the patients is first that we are able to do a much more predictable procedure, which will deliver a better result at the end of the recovery. And one of the main advantages is the post-op, of course. So the post-op of our patients changes completely. They have much less swelling. The chance and occurrence of post-op bleeding was extremely small after using piezo surgery. So there are many advantages that are from the immediate post-op to a long-term post-op.
In your opinion, is there any disadvantages in using piezo surgery?
I believe there are no disadvantages. Some surgeons, in the beginning, they are a little bit more reluctant because of the speed. They believe it's going to be slower, but actually after you get enough of a learning curve, piezo surgery becomes extremely fast, and the predictability and the safety compensates completely the small difference you can have on the speed of the cut. So I don't believe there are disadvantages.
How long did you take to master the technology and fully understand how to use piezo surgery?
Well, I can say that I'm still learning, because piezo surgery is developing new inserts, so we have to adapt to the new inserts, and they are very helpful, but then you have to change the way you feel it when your hand. But I can say that in less than a year, you are already being able to master the technology in a way that you can do cuts quicker, in a more predictable way. So I don't think it's such a long learning curve, but it's, of course, as any other instrument, it's a constant improvement of yourself using the instrument.
Is there anything else you would like to add?
Well, I'd like to add that piezo surgery nowadays in our center, it's something that it's completely necessary, that we base most of the results that we tell our patients they are able to get by using the correct instruments, not only piezo surgery, but we use other technologies as well that are necessary, from CT scan to software for surgical guides, for the post-op treatments that we have special technologies as well. So piezo surgery is one of the pillars nowadays on the way we perform our facial recontouring procedures.
Thank you, doctor, for your time.
Thank you.